There's a war going on outside no man is safe from. It's the war against health insurance's prior authorization. The health insurance industry's prior authorization policy makes a financial killing and kills people at the same time. Prior authorization kills patients by delaying medical treatment, denying patients access to treatment, and forcing patients to operate lengthy processes aimed at pressuring them to forego treatment altogether. Unfortunately, many people are already all too familiar with prior authorization. In case you don't know what it is, prior authorization is a process that requires doctors to get approval from the insurance company before a prescribed treatment, test, or medical service qualifies for payment. In other words, your doctor must check to see if the insurance company will pay for the medical treatment, test, or medical services you need to get well. If they don't pay for the treatment, you have three options. Option 1, you can ask the doctor for an alternative treatment. Option 2, you can appeal the process. And option 3, you can just give up. Insurance companies claim that prior authorization can reduce inappropriate care and keep healthcare costs in check. However, evidence shows that healthcare costs have not been held in check, but are rising. Over the last 50 years, total and individual healthcare costs have increased. According to the American Medical Association, 91% of physicians say prior authorization has somewhat or significant negative impact on clinical outcomes. Prior authorization kills patients by delaying medical treatment. 1 out of 3 physicians reported that prior authorization delays led to hospitalization, disability, or even death for a patient in their care. While a patient waits for the blessings of the insurance company, they continue to get sicker and may have a medical emergency during the waiting period. In a report published in Inflammatory Bowel Diseases, clinicians examined the prior authorization for 42 IBD patients. The average time from prescription to prior authorization approval was 5.8 days. The longest time a patient waited was 34. The excuses insurance companies give the public for using prior authorization is to ensure that drug therapy is medically necessary, clinically appropriate, and aligns with evidence-based guidelines. Insurance companies delay patients from receiving medications that they need as well. Approximately 70% of prior authorization requests start at the pharmacy because of a rejected claim. Many doctors are unaware that the drugs that they have prescribed require prior authorization. Doctors find out when the patient or the pharmacy contacts them about it. 83% of physicians say that the number of prior authorizations required for prescription medications and medical services has increased. Treatment delays and denial can lead to a reoccurrence of symptoms, disease progression, and increased costs. Prior authorization kills patients by denying them treatment. One example is the case of Kathleen Valentini. Valentini's attorneys argued that her health insurance company's denial of prior authorization for a MRI constituted negligence and medical malpractice. It started when Valentini's hip began to hurt, so she went to a physical therapist and took pain medication. After 6 weeks of therapy, she was still in pain, so she went to an orthopedic surgeon. The orthopedic surgeon requested an MRI from the insurance company, but the company denied the scan. The insurance company wanted Valentini to complete 6 weeks of physical therapy, which she had already completed. The company did not reverse the decision for 40 days. The doctors discovered a sarcoma and needed to amputate her hip, pelvis, and leg, but they were too late. The sarcoma had spread to her lungs. Her doctor said that if she had come in 1 month earlier, she could have been treated with chemotherapy only. The delay cost her half of her lower body and contributed to her early death. These companies are not medical professionals, but operate as gatekeepers and decision makers for access to essential medical tests. Surveys from the American Medical Association show that 87% of physicians report that prior authorization interferes with the continuity of care. Prior authorizations force patients to navigate lengthy processes concocted to force them to forego treatment altogether. The goal of the insurance company is to make profits for their shareholders. Make no mistake, health insurance companies care about profits only. Caring about patients is a front. 78% of physicians say that prior authorization policies sometimes or often result in patients abandoning their recommended course of treatment. Patient abandonment is the goal of the insurance company. These companies profit by keeping the monthly premiums while refusing to pay for medical services. When patients give up on getting the care they need, the insurance company makes a profit. 27% of physicians report that prior authorization requests are often or always denied. Instances have occurred when prior authorization becomes denied without reviewing a patient's medical information. Insurance companies claim that these denials without review are a product of clerical errors or glitches in the system. Do physicians and the general public believe the excuses of the insurance company?
No. No. Mm-mm. Mm-mm. No. 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 No.
Health insurance companies work against patients and physicians because denying or rejecting claims is part of the business model. Insurance companies claim they are not trying to burden the patient or physician, but the evidence shows that is exactly what they're doing. It is a burden that 35% of physicians have dedicated staff members who focus solely on prior authorizations. Hiring people to handle prior authorizations wastes money on a process that does not improve patient health or physician effectiveness. People have been complaining about prior authorizations for a while now, but the solutions to resolve it are a joke. Insurance companies assert they will streamline the prior authorization process, but nothing substantial has happened. If we think profit-driven insurance companies will self-regulate, we will be disappointed. The burden of obtaining prior authorization has another impact on physicians as well. 95% of physicians say prior authorizations somewhat or significantly increases physician burnout. So, not only does prior authorization kill patients, it kills physicians' careers. The solution is not to try to improve how health insurance works. Health insurance companies are, by nature, unethical. The solution is a system where a single entity, usually the government, pays for all healthcare costs. A single payer system that would eliminate the insurance companies. Insurance companies influence our politicians through legalized bribery called lobbying. Large amounts of money are given to Republican and Democratic politicians to keep the current system in place. They do their best to convince us that the current system is better than socialized medicine. According to the National Institutes for Health, Medicare for all would save more than 68,000 lives yearly. Politicians and defenders of the status quo tell us that people have to wait for treatment under socialized medicine. This argument is asinine because people are currently waiting for treatment now because of prior authorization tactics. We find that the expected savings from a universal single-payer system would more than compensate for the increased expenditure associated with universal coverage. Universal health care would save lives and save money while simultaneously improving the quality and productivity of those lives.